Okay, so it is my pleasure to be part of this meeting and to raise some ethics issues that come up when we talk about digital health. I don't have a lot of time, so I want to organize my remarks into three parts. The first is my sense that we don't always talk about the purpose of a data aggregation activity, and that the purpose can be really relevant to the ethics of an activity. Digital health or databases that include digital health are not all the same thing. I'm then going to talk about a bunch of different ethics issues that come up in digital health, and my tagline is, ethics is a lot more than privacy and security. And then the third, which I'm going to spend a very brief amount of time on, is that it is essential ethically to keep our promises to stakeholders. I hope that goes without saying, but maybe not quite so easy is to think about which promises we want to make and which ones will be harder or easier to keep. So what do I mean about the purpose of a digital health activity being important to determine and articulate, and that it is relevant to ethics? So digital health data sets are created using a bunch of different models, and I'll lay out a few of them, but obviously there are hybrids, and these are just meant to be broad categories. So there's one category that is sometimes called a learning health system, or is aspirational to a learning health system, which is a digital health system or aggregation of electronic data that really are internal to a specific organization. A particular health system creates it aggregates a lot of data, and it's really their patients' data from which they want to learn. There also are standalone external data systems, and some of these are research data systems, some of these are commercial data systems. And again, the purpose of these not only becomes important for the people in charge of them to think about, but when we get to the next part about transparency and the importance of communicating this to the individuals whose data will be included, it becomes really important to be able to say, for example, we're collecting these data so that we understand what's working in the care we're delivering so that we can deliver it better to people like you who come to our health system. Or we're collecting these data so that we can sell it to a lot of people because there's a lot of commercial value. They're really different. In certain ways, there's nothing wrong with either of these, but they become very different kinds of data systems. Part of this includes things like, will the data be used only internally or shared externally? And part of this will translate into whether the individuals whose data are included in a particular system might stand to benefit directly from what is learned through the data aggregation and analysis process. I've put here just a few different models. I've already talked about a learning health system, which might be internal to a particular healthcare institution. I'm involved with the All of Us research program, which is the NIH's large million American research study, which is trying to create the largest database that we have that is federally funded of a heterogeneous group of Americans so that many researchers from all walks of life can learn from those data. And of course, there are then independent commercial databases of many flavors. So here is a bit of a laundry list. I call it at least some of the important ethics considerations in digital health. And let me jump into a little bit of discussion around each of them. So transparency is obvious on its face. But again, for so many of these ethics considerations that I'm going to raise, there's a lot of devil in the details about what is really required quite specifically. So part of the point of this first bullet is that transparency is required, but substantively about what topics, and we'll talk about a range of additional features of a data system that each involve a decision. So the other things on my list here of ethics considerations will raise additional topics where decisions need to be made. For example, what is identifiable? With whom can it be shared? Under what conditions? And each of these is really an important candidate for transparency. These are all things that ought to be shared with people whose data will be part of the system. But it's not only a question of, is there a commitment to transparency, and what are the things around which we who run this data system are transparent, but is it meaningful communication? All of us have seen the agreements that we're required to sign or click a box for on so many apps and other things that we want to have access to on the internet. And I think most of us would agree that these are not meaningful in terms of being in a format where we are likely to read them, where they're sort of user-friendly. And yet there are people who specialize in trying to figure out how to communicate complex information in really simple ways, with graphics, with much smaller bits of information. This is certainly an area where less is more. So is it meaningful transparency, not just following the letter of the commitment of transparency, but the spirit in which it is there ethically? So now that we say, okay, we're going to give people a lot of information about a data set and why we're collecting your data, is there an option for consent? So is this simply disclosure? FYI, everybody at this health system has their data put in this database, or everybody who uses this app, we now collect all your data. Or are there any kinds of permissions? And again, is it permission just if you're going to use my app, then you have no choice but to have us have access to your data? Or do you actually have any kind of opt-out? And again, is it sort of meaningful? Do you understand it? Is it clear, et cetera? Privacy and security is probably where, at least in my view, people have spent the most time thinking about the ethics of data sets. And of course, that is for understandable reason. We want to know if our data, and particularly our health data, which can be very private, very personal, are going to be kept private. I may believe in the mission of this data collection enterprise. I may believe that I want to be a participant in the All of Us research program. It stands for some pretty important things. But my goodness, I also want to be assured that the information about me, my family, our health history, our mental health history are being kept quite secure, and that I have some choices about which of my private information I'm going to share. So speaking of sharing, but in a different context, data access and sharing are, again, another set of decisions that people who run, own, and manage a digital health database need to think about. Who has access? Who can get access to these data? And why? And is the overall purpose that they have to improve the health of the individuals whose data are in there or others like them, to commercialize, with what protections? In other words, I may have created this database and have very clear commitments to privacy, security, transparency, but someone else who accesses the data may not necessarily share all those commitments unless there are certain kinds of agreements that are made clear to them that they must also commit to sign documents about. There can be carrots and sticks, which we could talk about later, to help ensure that both the people who created the database are following all of these commitments, and that anyone else with whom data are shared also follow them. Ownership and governance. So some of this is sort of straightforward, although who is managing not only a database in a technical sense, but who is in charge of all these decisions? And more decisions will emerge constantly. Becomes, again, a really important question. And some such enterprises, some databases, some research studies have as one of their core ethical commitments, and almost what I'll call identity commitments, engaging participants, engaging some of the people whose data are part of it, or even have a governing board that is either made up of participants or includes participants. as a means both of certainly being transparent, but of being responsive to the interests of people whose data are in there and their priorities in continuing to make decisions. Justice and fairness is always important in data and in ethics. This means lots of things. Here's just a couple of examples. Whose data are included? And if you don't go out and intentionally find a lot of people, you will default not have as heterogeneous a database as you perhaps want. What inferences can be drawn? You can only draw inferences from the people who are there. And then which questions are examined? Do you have a commitment that you have to have dedicated consideration of those least well off? Benefits and purpose, I've already talked a little bit about, but I'll say something just a little more narrowly. Do participants themselves benefit? In a learning health system, that is often a commitment. You get your care here, we learn from it, we try to deliver better care going forward. And then my last slide. There needs to be integrity, and there needs to be some kind of, again, both sort of carrot and stick, some incentive to do the right thing, but also some penalties if all of these promises that we've made are not kept. It's easy to say, we're going to be transparent. We're going to do data related to the questions of the least well off. We're going to keep everything secure. But there need to be checks and balances against those kinds of commitments. And again, it's key which promises actually are made. Okay, that was a whirlwind. Thanks for your time, but I look forward to the discussion that we can all have together in a few minutes.